In 2005, I was visited by the CEO of a new organization called EMRI, and at that time he came to visit my office at Stanford and was talking about this brand scheme for a national ambulance service for India. And I remember hearing his story and thinking, this is great, but it's doubtful that anything like this could ever happen in India.
In the year 2004, we got this idea of starting emergency service, and a group of philanthropists joined together. On 15th August 2005, we inaugurated here with 14 ambulances.
Whenever there is an emergency, they dial 108, and within 15 minutes, our ambulance service goes to them, pick them up, and they give the medical aid, take them to the hospital.
We found that there is a strong need and a gap to understand the global best practices in terms of emergency medical care. Then we did some networking, and most of the people have recommended Stanford School of Medicine. There were few individuals also, like Dr. Mahadevan.
To begin with, we served as unofficial advisors, so we would visit their campus, we would observe their practices, we would give them guidance, and then over time we discussed developing a training institute to train paramedics. And from that point forward, we've been working hand in hand with EMRI, with now G.V.K. EMRI, to develop training programs, guidelines for emergency care, physician training programs.
So the advanced EMT program, what we started with Stanford, has come out with a big magic because they were able to really contribute in not only in the training but in services, in research, as well as in capacity building also.
The problems associated with providing emergency care to people in very crowded urban environments, and then to people in dispersed rural environments, those problems are the type of problems that have historically attracted Stanford faculty and Stanford students. This initiative provides a great example of how the inspired leadership of a group of Stanford faculty, coupled with extraordinarily dedicated people here in India, how together they've been able to have remarkable impact on the lives of the citizens of India.
We partnered with G.V.K. EMRI, and they're solely responsible for building the ambulances and the architecture to develop the ambulance service. Leveraging the industry that had already grown, the call center industry in India, they decided to change it up and develop their own call center. In the area of 2 basketball courts, they're able to provide EMS dispatch for 80+ million people, which is incredible. We don't see cobra bites in the US. We don't generally see pesticide poisonings. It's not okay just to say, here's the US system, let's copy that. We decided that we really need to develop our educational curricula and guidelines around those entities that you see here on a daily basis so that they could be effective in caring for patients.
Many of these paramedics who have graduated from the Stanford G.V.K. EMRI 2-year advanced programs, they are manning many of the hospitals. They are manning many of our advanced life support ambulances. They are in great demand in other countries also. They are able to be part of our research activities. They are able to be part of our training activities. They are able to be part of some mid-level and supervisory staff at the operations level.
It's hard to fathom in 10 years what this program, what this system has done. It went from a program in 2005 that didn't even exist, and now today has grown to an emergency medical system that covers most of India and takes care of over 750 million patients, which makes it the largest ambulance service in the entire world. In many ways, this could be regarded as one of the most important advances in global medicine in the past 10 years, just by virtue of the fact that it takes care of so many people and that so many citizens of the country that had no access to emergency care, especially those living in rural areas, now can dial 108 and have access to an ambulance within minutes and get expert medical care and transportation to a hospital that's close to them.
The amount of trust we create, the amount of confidence we create in the people that in dire sequences we are there to help. What we call my Huna in India. I am there in terms of distress.